Good evening, everybody. Thank you for joining us. I'm Dr. Kristen, and this is Monarch Family Chiropractic's final workshop, ending and rounding out March, believe it or not. And we're going to talk about preparing your body for sports. And because we haven't done many topics along these lines, I'm keeping it very simple, very kind of 101, and just covering some basics in how it relates to just different movements. And you can apply it to probably any activity or sport you play. I picked a couple that really have to do with rotation or swinging, just because it's the motions I did playing sports and the things I still do when I do an activity. But a lot of the principles are the same. So we're going to cover some basics, and there's so much that goes along with how to prepare your body, and many of the other ones come into the play of nutrition and different training. And there's a lot of great data Doc and I just got in some trainings that we did this past weekend and in January as well, that I know are coming in the upcoming workshops in more depth. And hopefully this just gives everyone from kind of that young kiddo getting started in things and getting active, and maybe even just doing a tumbling class or learning how to move their body in what we even see in pre-K age ranges after they're walking and starting to run. Though there's important things for them to learn early on for movement. And this applies all the way into, some of my later, 60, 70, 80th year, decade generational people playing things in their retirement, whether that's walking, whether it's yoga and things like pickleball, or lots of different movements. So we're going to just jump right in and talk about a few things in preparing for. But, movement or activities at all level is really, we want to cover, function and movement and why that leads to performance. I don't think any of these things will be big shockers or surprising, but I think it's good reminders for things we all need to do, no matter whether we're doing something seemingly very laid back, simple, or we're really competing at a performance, amateur or pro level. I mean, everybody does versions of things for their function and movement if they want their performance to not only be well, but to also serve them in recovery or in even just lack of soreness, right? So really, we're going to cover a little bit of the pre-post activities and chiropractic's role. And many things with function and movement, it's really about performance. So one thing that, I touch on here at the very beginning, but that we'll touch on at the end, is some different studies that show, what types of athletes or people in performance activities do good things for their body and for their structure. And so there is many studies from amateur to pro, from high school, college to pros, where all studies show some range that's well over 50%, most of them 70, 75% of athletes that are under chiropractic care and care with their other body workers and therapists on a weekly basis. And so one thing that we know is key is to performance and movement is that we really need to warm up the body. Any pre-performance, of any kind is getting movement happening and getting the body warmed up. And just benefits of that, as a reminder, hopefully to everybody, is the big picture is injury prevention. It's that we really want to optimize the performance. And in many activities, I put swing in parentheses, but in many activities, you've got to have to have greater flexibility in motion. We've got to warm things up in a certain way. We've got to work on big muscles and then kind of core intrinsic posture muscles. So you're going to have greater mobility there and motion through a movement if we can get that warmed up properly through some version of stretching and blood flow to warm up. Allowing things, allowing a follow through with emotion is really going to create less injury opportunities or sprains, because you've got things warmed up, because you've done a proper follow through, which requires a proper warm up, if you will. It improves, your muscle endurance. It's also showing just how you're going to have fewer aches and pains, therefore less chance of injury or that sprain strain. But really, we want to have enjoyment in whatever we're playing, whatever we're doing in our activity. And so that's going to increase that ability when we are prepared and warmed up for that performance of any kind. And when we get into components of really, what helps or what affects that. It's that, a stretching in any kind of warm up, the muscles that are warm are loose. So we really want to have that full moving potential through the body when we're doing a stretch, but also when we're going out to perform. And really, it's, I think, key that we slow down enough. It doesn't have to be for a real long period of time, but that when we're doing the deliberate movements, we're being slow about it, and we're easing into it. So I think that people may tend to actually feel more stress or strain when they're going through things really quickly, when they're taking it past its normal or comfortable range of motion, and going from very, if you will, cold in the body and the muscles to an activity, and not allowing enough time for the large muscle groups, especially, and then some of those smaller intrinsic core posture muscles to be warmed up and loosened as well. Some of the, now, I didn't go through and put lists of them because depending on what you're doing, that could be different. But really, when we're talking, large muscle groups with warm up and stretching, and maybe we'll do more video that we post with our YouTube channel on looking at ways in which we have so many workshops we do on stretching and movement and all the spinal hygiene that, that's a great place to go as a resource if you're looking for how should I move the body? How should I stretch the body? Any of the workshops from the desk yoga that we did, which is really just sitting and doing more movements and stretch while we're at a desk, versus really how are we loosening up big muscle groups, fascia in the body, and then smaller intrinsic posture muscles. So we can help with different tools and apps we use in the office, and tools that we already have on YouTube, with showing you ways that you want to, warm your body up. But large muscle groups really involve, things through the arms, chest, and the neck, things through the hips and the legs, so front, side, and back, if you will. And then when I say core and postural, it's, when we talk about different things we do with certain yoga poses are more postural and more intrinsic into the core. So there's many different types. And I think, what's nice is I feel like there's many ways in which to stretch. And as long as you're following what you're listening to your body and you're doing things in a good posture and you're not going fast, I feel like one thing when we talk about and something, Doc says in a lot of in workshops about sitting and about movement is just when someone asks what to do or what's the next, what movement to do, it's the next movement, right? It's just keeping moving and keeping in that loose, stretched way. So some of the exercises or stretches we show you in the office have more to do with your core or your posture muscles and making sure that the front and intrinsic part of your hip is loosened and parts of your back and postural muscles along your spine. Some of the smaller, deeper ones in the front of the neck, as well as back of the neck, and the smaller ones of the shoulder can be really helpful, especially in a swing motion, because you can really overstretch and strain, and then you can bring a lot of torque into the system. And I think that a lot of sports either have torque in it of some kind. So whether it's you're doing a twisting motion that many people probably think of as torque, or you're doing more of a, I think about a movement like with basketball where, yes, you might go forward, but there's a lot of side to side. There's a lot of lateral movement, and that can put much different stress and tension into ligaments and tendons and joints if we're not warmed up and if we're not in good alignment, as well, because joints aren't necessarily designed to go that way. In lots of ways. So covering some do's and don'ts before we get into some of the a few of the studies and research that I'm going to show you or just tell you about is just that in thinking about certain activities, there's things that we want to think about what we might do that creates stress upon our system in a sport, or even leading up to, that I thought was a key thing to mention, because it can be part of the hindrance. And when we talk about posture in our core, if we aren't in good alignment in that posture, then it really creates the tipping and tilting of the body, and then overuse. And then it's just not we're not doing things in an ergonomic or even way. So With sports, it was really talking about really looking at key things that people notice when the docs that are working with some of these athletes mentioned is that watch what they're carrying with them. How much are they putting in their bags, whether it's, a golf bag or whether it's, a baseball bag or, a lot of the sports that have those elongated bags because they're carrying either a puck or a stick or, gear and all of the pads with that and all the components. So it's watch what you're carrying with you, not just in how you are holding that stuff, but if you play a sport where you carry it with you or you take it with you, like golf, it's really being ergonomic and minimal. So every sport had a list of like what you put in your bag and what you don't, or really how to minimize that so you're not carrying more weight. So I'm not going into that kind of detail tonight, but that kind of stuff is out there and just worth to be aware of with what you do, with what sport, or if you're doing tackling a sport at that level where you have your own gear and you're taking things with you. Canceling the cart is definitely directed, more with golf, but there's other activities where people, are going to get more value in their body, more function and mobility by walking versus riding. So elevating that aerobic ability and activity and endurance, and then creating more stamina. And it also supports your immunity when you're doing more of those activities. And using that, getting more of that aerobic activity for the heart and the body. So that's an immune booster. Something that if someone is having discomfort is, leaving the Advil, the ibuprofen, the medications at home. They talk a lot about how that's how a lot of injuries happen as well, is people take things that mask then the pain they're feeling or the symptom, from brain to that muscle or body part, and then they injure themselves in overdoing and playing or doing the activity. So they don't feel it, so they continue to play, or it relaxes, so they go past the motion. The joint is trying to stop them at because it doesn't feel right. It doesn't move right. And it's trying to tell you something by stopping you from moving all the way, right? And so to mask that is really a recipe for injury that they say many people, many docs found in sprained strains is there was already an irritation, there was already an aggravation, there was already a lack of motion, and they were just trying to push through it or take something that then they didn't feel it, so they kept utilizing the body in the way it didn't want to move and created an injury. And, last but certainly not least is, correct posture. I forgot to put a slide in here that we use many, many times in the office and in lots of workshops, but I think one of them may have made it into here. If not, we'll add them in next time. But if those of you that tune in frequently or in the office and understand the posture, what your posture picture should look like. What posture looks like when you're in a good alignment front to back and side, from the side view. And that when the posture is poor, when we think about if any of you have had foot scans, if any of you have had some of the other scans we use with a posture picture, and when you're looking at a tilted shoulder or a tilted hip or a tilted head or a shift, right, where the whole body leans one side of neutral, and it can be, a few millimeters, it can be a few inches. All of that is significant and increases the risk to all kinds of injuries and all kinds of misuse. So we can use our joints and our body differently and overuse areas that we shouldn't by kind of compensation, right? That it just creates a risk if done in a poor way, or if not moving in a good way and by poor posture. And so when we talk about some of the studies, which is where some of this comes in, why chiropractic? It's because it's boosting posture and performance and movement, right? Because we support correcting the mechanics of the body and what the body is doing and how well it's able to move. But even just an example of, if something's stiff, like a hip or a back, and that musculature is what that stands for, sorry, are really root causes for flawed mechanics and movement is really what that mechanics is. And so the couple things that were talked about when in relation to hockey, baseball, golf, I lump that in with like lacrosse, things where tennis or pickleball, things where you are swinging. There was a lot of studies I was reading about, and one in particular that just talked about how shortening the backswing for people that are in those kinds of activities or sports really can help reduce the trunk or your midsection muscle activation, which sometimes that's a help for somebody who's got lack of motion there, or is worried about over rotation or damaging something, injuring something in the trunk area, in the low back and hips. What that does in turn, though, is it gives an increased shoulder activation. So we have to watch that we're not overutilizing the shoulder or the upper body, because we're slowing down and minimizing or reducing some of the swing or rotation in the trunk in our midsection. And ultimately, if we can remove those subluxations within the structure, within the spine, that, and then the joints and the extremities, that creates that dis-ease and improper function, you're going to improve. Obviously, more motion comes, and then more function comes from that. So some of the studies and some of the things that that I was pulling up that I didn't necessarily put in the slide, but we have it here if you want to see things and read out of. Some of it was from JAMA, some of it was Med studies, that there's a lot of because there's a lot of teams, especially at a high level performance, who, chiropractic is on staff and adjusting athletes pre and post games and pre and post practices at multiple levels of sports. There was a lot of things referenced that way that was applicable, I feel like, to share. There was a couple studies done in 2 different clubs happening with smaller study. This one was with, I'd say, about 70 to 80 athletes, but they were divided into 2 groups, and it was all were average age, kind of handicap, and then their initial swing was comparable to each other. Both the groups were to take part in a stretching program, but also the one group that was divided in half, one group received chiropractic care once a week for 4 weeks. And it just showed how in each session, all the golfers performed basically the same, what they call certain full swing, like 3 different full swing maneuvers. So everybody was judged and I guess graded on the same movements. It was that it was looking at the ball range, and at what it was considered at the average distance for the 3 shots, basically. So they were, taking in data and trying to keep it as fair or even as possible as what they're measuring and how they're measuring it. But basically, after the 4 weeks, it really just showed that golfers that underwent both the stretching and chiropractic had significant improvement in their full swing performance. And they didn't see any swing performance at all in the group that just stretched. So there was also some other studies that I didn't have time to pull, but it was really talking about, they made a fun kind of statement of, let me see if I can reference where I put that. It was something along the lines of, those that want to have a handicap don't do these things, and those that don't want to have a handicap, which means you're playing at a higher level and you don't need the extra points or the support, right? Then, go ahead and be doing things that are movement for your body and correcting the mechanics. And they talked about how the top 2 things was just mobility of the spine and posture in whatever the motion was, whatever the activity was. And then there was another 3-week study that was done, and this was more looking at a higher range. It was over 1,000 amateur golfers, and it was just talking about how when they saw the performance difference, the ones that had who outperformed the other group, and it was more men than women. This was a not even study there for where they did it. It was mostly men. But they were talking about the performance of that there was no change. The ones that had the handicaps were the ones that only about 54% of them did some form of a warm-up, but that 88.7, so almost 89%, who did warm-ups and performed those, what they kind of call like a air swing. So it's a particular motion you do to warm up at the tee before you golf. Just showed that those are the ones that had the lower handicaps by and large over this group of 1,000. So just looking at studies in a sport that I like to play and that I've grown to love as an adult, that I didn't play when I was younger, that is very complicated and hard compared to, I feel like, what it looks like. It was really cool to see how correlated it was with mobility and performance and lack of injury, and how all those things are key in creating an activity that you love, but creating a movement that is good for your body, whatever level you're at. And that just adding in very simple things in your routine as warm-ups and as kind of good muscle, core, trunk activation movements, that just allows you to have it showing better performance in the end. So, I mean, ultimately, what do we want to support everybody with is things that are supportive to you and how you want to move. And so if it's, wanting to do an activity that you haven't been able to do, let's talk about it. If it's getting to a place where, you're just wanting to get back on your feet and walking more than you are and getting in steps, great. Let's talk about how to support that. And it can go from, literal baby steps to onto people that are doing high level things. All of it stems from our core. All of it stems from our structure and how do we carry ourselves and how strong and balanced are we in symmetry and in how we carry ourselves and how supported we are in being able to then do what may be a minimal movement or an extreme movement. It all stems from the same core principles. So hopefully you took a few takeaways from this. And if there are particular stretches or activities for what you want to do in preparing your body for your activity or your sport at whatever age, I think please, chat with us in the office. There are some new tools that we are implementing that we're going to have access to soon, that patients can really have some structured things to follow if they want to, and being able to tap in and look at that, do those activities, chart what they're doing, and kind of keep track of that. But also to have us, help you in that and support you and kind of be an accountability partner to doing some movements maybe outside of the ones you learn in the office. So who do you know, right? Who do you know that chooses movement? Who do you know that wants to be doing more than they're able to do? Who do you know that's struggling with maybe doing some things that they wish they were doing that would bring them joy? Have them come in, let us assess, let's see if there's anything coming from the structural perspective of their frame and how we can support their movement and their overall function. And you'd be amazed to be able to hear the stories of people that are doing some awesome things in this office that, weren't 2 and 3 and 4 months ago. So I challenge you to think about, if it's not you, who is it? And have them give us a ring and see if there's something we can do to support their better function and their vitality for life, because we know movement equals function equals vitality equals years added on, good years added on to your life. So thanks for joining us tonight. We will see you next Tuesday and have a blessed week. Talk to you soon. Oops, what do I do when I do that?